My name's Kayla. I'm going to be doing a wound dressing change. I assessed your patient records and it said it needed to be done. I'm performing my hand hygiene. I just need to identify you. Can I have your name and date of birth, please?
Patricia Stone, 32372.
Well, thank you, Miss Stone. Can I identify you with your wristband as well?
Mm-hmm.
All right, thank you. So I just want to make sure, are you in any pain right now?
I'm not.
All right, do you have any latex, food, or iodine allergies?
I don't.
All right, are you comfortable? Do you need to be adjusted?
I am perfect.
All right, so all this stuff might be intimidating since I already assembled it, and I don't mean that, but all I'm going to do is I'm going to change your dressing. I'm going to remove it, I'm going to irrigate it, I'm going to replace it, and if needed, I'm going to do a culture. So I'm going to close this curtain really quick to ensure more privacy, and then I'm going to put this bath blanket over you as well. All right. Thank you, Miss Stone, for all of your cooperation.
Yes, thanks for keeping me warm.
Absolutely. So it does not look like there's any drains, tubes, or adjuncts coming out of the wound, so that's great. So we don't have to be extra super careful. So I'm going to put on my gloves, and first I'm just going to remove the dressing so there's nothing to be afraid of.
All right.
I'm going to be using a push-pull method. So if there's any pain when I take off your bandage, please let me know and we can accommodate for that, okay?
I will.
Thank you so much. So just let me know. Pushing on the skin, pulling on the bandage. Pushing on the skin, pulling. How you doing, Miss Stone? You still doing okay?
I'm doing good. It doesn't hurt.
All right.
Had
Good
3
job.
babies in my lifetime.
Oh,
I'm
wow.
a strong woman.
So you're doing just fine,
Yeah.
huh?
This is nothing.
All right. Well, thank you so much for being so accommodating.
Yeah.
All right, let me get this last piece of tape. All right, so the wound looks very good. So what I'm going to do now is I'm just going to assess the drainage and assess the wound. If I can get my gloves to stop sticking to it. So it looks like it's a bit red, so it might have been blood, but it looks like there's some granulation tissue, so you could have accidentally pulled the scab, which made it bleed, but it looks like it's healing really well. There's not an excess amount of exudate coming from the wound, since it is only a stage 1. It's red, like I said. There's no odor. No
Yay.
odor to it. Yeah, so there's no infections. I'm then going to examine your wound. It does not look like there's any necrosis, any undermining, any tunneling to it. So that's amazing. It's healing really well. All right, so I'm going to properly get rid of this, keeping all of the contamination inside, and then doing the same thing on this side. So after I remove it, I'm going to dispose of it properly. I'm going to do my hand hygiene. All right. According to my facility policy, I have to let it dry after doing it really well. So the next thing we're going to do is we're going to add more gloves. If I can put them on properly. So I'm going to assess the length and width of the wound as well as the depth. So I'm going to measure it using this so it's disposable. It looks like it is about 3.5 centimeters, getting as close to it as possible while measuring the longest point. I'm going to measure the widest point as well. So it looks like it is a little under 1 centimeter, so I'll put the exact number in my charting, and then I'm going to measure the depth of it with my Q-tip. So if this were deeper than a stage 1, I would put my fingers at the top and I would slowly drag my fingers down until I met contact with the wound, and I would measure that. But like I said, it's a stage 1, so it's not going to need a bunch of measurements. The next thing I have to do is, according to my policy, I have to do a culture if it's more than a stage 1. Right now we don't need to, but I will still demonstrate it. Usually a culture comes in a tube, so you open the tube, you get the cotton tip nice and saturated from inside the wound, then you put it directly back in the tube. If this is too long, you snap it off, and then you label it with the time and date and where it needs to go, and then you automatically send it off to the lab for it to get tested.
Okay.
All right. So now I'm going to dispose of all this properly, and I'm going to take my gloves off, and we're going to set up our sterile field. Don't get nervous, this is just so we can make sure the wound is clean. So I'm going to dispose of this properly, perform my hand hygiene. All right, gonna set this to the side. I'm gonna move your blanket over there. You still doing okay, Miss Stone?
I'm good, thank you.
All right, my hands are almost fully dry. So what I'm going to do is I'm going to take my already clean surface, and I'm going to open the sterile packaging towards me, and I'm going to dump this on there, back away, and dispose of properly. I'm then only going to grab by the corners, my 1-inch border, making sure I never cross my sterile field. If I have to walk my fingers across, I will do it this way, making sure it is all unfolded. And in order to make sure I'm not going to cross my sterile field, I'm going to turn it away from me, keeping my fingers on my 1-inch border, and lay it away from me. Still not crossing my sterile field, ever. Next, I'm going to open my irrigation tray. I'm going to take this, open this away from me, make sure I stay away from my sterile field, dispose of this properly. I'm going to introduce this 6 inches above, step back, and I'm going to use this irrigation tray to irrigate the patient's wound. I am then going to open my cotton tip applicators. It's the same thing, open it away from me. Doesn't look like these were openable like normal, I apologize. Dispose of properly. So open them towards me, making sure I'm not touching anything, and then introduce, and then back away. Dispose of properly. Next thing I'm going to do is my sponges, my gauze sponges. I'm going to open away from me, never crossing my sterile field. I'm going to dispose of this properly, introduce, back away. And I'm going to keep this for the saline I'm going to then use.
Okay.
Next is my ABD pad. This is just gonna go over the wound to protect it. So I know this looks like a lot, but don't worry, okay? So we're gonna open it towards me, still not touching anything. Introduce, back away, dispose of properly. And then the next thing I'm going to do is I'm going to grab my saline by the label, and if it is not open, it is not expired. So I'm going to open this, and never crossing my sterile field, I will dump some in here just to make sure I have enough for the packing and for my irrigation syringe. And then I'm going to put this down, making sure the label is not any kind of washed away, drained. And I do have a barrier for you, Miss Stone, if you ever get uncomfortable with the adhesion, okay?
Okay, it's like a tape protectant, or?
Yeah, all it is just to make sure when the next person comes in on the next shift, if they take off your tape, it's not going to hurt you. If it does, it's not going to be as bad as it would without that barrier.
Perfect, thank you.
Absolutely. So next, keeping away from my sterile field, I'm going to don my sterile gloves.
Okay.
And I know this still seems intimidating. Please do not worry.
You make me feel very comfortable.
Well, good. I'm glad I can do that. So I'm going to open my sterile gloves away or towards me. I'm going to dump them and dispose of properly. I am then going to grab by the corners, making sure I stay away from any kind of sterility because these were sterile to begin with. I'm going to start with the top flap, making sure I stay on the flaps alone. And instead of grabbing from the inside of the package, I'm going to walk my fingers underneath these flaps and use these to my advantage. So now everything inside of here is sterile. So I'm going to go ahead and don my sterile gloves properly, using my dominant hand to put on first with my palm up. And I will make any adjustments that need to be done after I get both gloves on. To get the second one, I walked my 2 fingers under the cuff and I kept my thumb out. I'm going to do this one palm up as well, making sure I do not touch any contaminated areas, and any adjustments will be done with the sterile part of the glove on the sterile part. All right, so I am sterile and I'm keeping my hands above a sterile field.
Okay.
I'm grabbing the sterile part of the container and I'm going to dispose of this properly.
Perfect.
Make sure I'm not keeping the area too cluttered. So next I'm going to get rid of this because we are not using this. And then I'm going to try to get all of my stuff a little bit nicer. So next I am going to get my saline into my syringe, making sure I do not touch the outside. So I'm going to introduce the saline. All right, so it looks like we have enough saline for this. I'm gonna make it a little easier because I have a little bit of a tiny hand. All right, never turning my back on my sterile field.
Yes.
I am going to come and clean Miss Jones's wound, or Stone's wound. I'm so sorry, ma'am.
You're okay.
So I'm going to clean from left to right until everything runs clear, keeping my syringe 1 inch above her incision, okay? So we're going to, all right, so it has run clear. Thank you. All right, so what I'm going to do is I'm going to dispose of this properly. My facility says I do not have to do it in a sharps container. I can just dispose of it because it has no needle. But since I have touched the irrigation tray, this hand is now clean or dirty, however you want to consider it, and this is my sterile hand. So next I am going to dry the wound, okay? So I'm going to take my sterile hand and I'm going to grab one at a time and make my little crouton. And I'm going to pat from the top and dispose, going back to my sterile field, never turning my back on it. And then I'm going to go to the bottom, also making my little crouton. How you doing, Miss Stone?
I'm doing good.
Okay. And then I'm going to dispose of this. And then I'm going to do the middle, making my little crouton being as tender as possible. All right, so are you still doing okay? Any kind of pain? Good. Okay, I'm trying to be as tender as possible.
Yes.
All right. So like I said earlier, there is no drains, there is no tubes that I have to clean around. So what I'm going to do next is I'm going to wet my gauze to make sure she gets packed correctly. So keeping the gauze away from the outside of the container and my hand on my sterile glove, I'm going to get this wet. I'm going to let that soak for just a second, make sure it gets fully soaked through. All right, and then I'm going to squeeze it out as much as possible. Again, keeping my sterile hand away from it. And while I'm doing this, I'm going to grab my Q-tip and I'm going to put it in my non-sterile hand, keeping my gloves away from each other since this hand is still sterile.
Okay.
And I'm going to, thank you, I'm going to pack this dry. It only had one packed in there when I got here, so that is what we are going to continue to do. So I'm going to very gently pack this wound. Are you still okay? Is this hurting at all?
It's good. It's good.
All right.
Not too bad.
All right. So then that is packed. I'm going to dispose of this properly. I'm going to get my dry gauze, which I already pre-labeled with my name, my initials, and the time I changed it. Or my initials, the date, and the time I changed it. My apologies.
Perfect.
And I'm going to carefully lay this on top. And I'm going to then... I mistook. I apologize. I'm going to grab my ABD pad first, which it's okay. I made sure that the wound is completely packed and the ABD pad does not have to be touched with a sterile hand since both of these are not sterile any longer. And then I'm going to tape it shut, which obviously it looks awkward. To make sure the ABD pads stay sealed as well. And like I said, it's already labeled with my initials, the date, and what time I came in. So now I'm going to remove my sterile gloves properly. starting by the cuff, keeping all contaminated inside. I'm going to continue to keep contaminated with contaminated. I am then going to do my hand hygiene. Oh, there it is. I am then going to gather my supplies, but is there anything else I can do for you, Miss Stone?
No, I'm great. Thank you so much.
All right, well, if there is anything you need, here is your call light right next to you. I will be back again if you call me, or I'm just going to check on your drainage again in case it starts to come through, and we need to make a note that it needs to be changed more than once per shift, okay?
Thank you.
All right, well, you have a great day.
You too.
Thanks.